Hi everybody and welcome back to the channel. This is Healthcare Honestly. I'm Dr. Bruce Charlesworth. I've noticed on social media and on the news and things that there's been a lot of mention of Lyme disease and ticks recently. Probably because of the weather we've been having in the UK and elsewhere in the world, and probably because of an uplift in the number of deer, because deer are a bit of a vector, a spreader of ticks. So what is Lyme disease? What is a tick? I'm just here to kind of clarify some of that information, tell you a little bit about what to look out for, how to stay safe, what to do if you do think you've contracted Lyme disease, what to look out for, and how that might be treated. Please do stick around. Please subscribe, like, and follow for the rest of the material on my channel. So, Lyme disease. What is Lyme disease? Lyme disease has probably been around for a long time, but it was actually really only recently, relatively recently for a disease anyway, identified and named. And that was in the late 70s and 80s. So it's not something that people are that aware of even today, although the awareness does seem to be rising, as does the treatment guidelines. Lots and lots of websites talk about Lyme. So what is Lyme disease? Well, Lyme is quite simply a bacterial infection. It's caused by a bacteria called Borrelia, which looks a little bit like a corkscrew. It's a spirochete, it's spiral shaped. And that little bacteria can get into a tick. And a tick is a spider-like creature that lives in woodland and in grassland and uses the deer as a bit of a vector. It uses the deer to tag onto and to move around, but it also feeds off other animals like rodents, mice, voles, birds, things like that. Now the tick can become infected with the Borrelia bacteria, and if you're unfortunate enough to get a tick that attaches to you and it stays on you for some time, there is a risk that that tick spreads the Borrelia bacteria into your bloodstream, and that is ultimately what causes Lyme disease. Now, Lyme disease is not that common, even in ticks. So there's probably about 1 in 20. In some areas, it's more than that. It's quite common in Scotland, in the south of England, in areas of Europe, and some areas of the US. So you do have to be a little bit careful depending on where you are. But not every tick bite spreads Lyme. That's because not every tick carries the Lyme bacteria. But it's also because even if it does, not every tick bite actually spreads the bacteria to its host, to you, the human that it's kind of tagged onto. So let's go back to ticks. What is a tick? A tick is, as I say, a spider-like creature. It has different life forms. It starts out as an egg. It turns into what's called a larva. It turns into what's called a nymph, which is a tiny little tick. It then turns into an adult, and then that cycle starts all over again. The ones you might see typically on deer or on dogs or on other animals that you see that are sort of pea-sized, for those of you who've got dogs and seen them, they're typically the adult ticks. So they can be up to kind of 10 millimeters across, a reasonable size, look a bit like a pea attached to the skin. But that's the body, and then the mouth parts are actually in the skin. Pretty gross to think about, but this is the reality of ticks. Now, when they're nymph size, they're tiny little things, about a millimeter across, just look like, sometimes can even mistake them for a bit of dust on your arm, for a mole, but it will look like a little black speck, and usually itches a little bit. So if you've been camping, if you've been in woodland, if you've been out walking and you spot this little black dot, which is a little red ring around it, and it looks attached, if you take a closer look at it, you might actually see the legs on that sticking out backwards. And what they do is they go in mouth first. So they bite you, they stick their mouth part in there, and then they sit on you for as long as they can, really, for days, weeks, until they're fully fed. Because feeding is the way in which they then sort of morph into the next phase of their life. That's what they do. They're always looking for a host to feed off to be able to change from a nymph into an adult tick. Now, different stages also have a different number of legs. Strangely, the earlier in its life cycle it is, a tick has 6 legs. It then grows a couple more as it goes through its life stages, becomes a nymph, and then becomes an adult. So a really interesting creature with a long life cycle. Actually takes a couple of years or more to go through those life changes. But unfortunately, the risk for us as humans is that we are at risk of Lyme disease if we are bitten by a tick. So first things first, if you do spot a tick on you and it's running around that looks like a little spider creature with a little body, just brush it off. Make sure that you get rid of those. Get them out of your tent, keep them off you, have a shower when you've been out walking, look for them on your body and brush them away. If you are unfortunate to have one that's become attached, they're still quite easy to remove. Now you can get tick pullers, which are like a little fork, a pair of forks that go underneath the tick and pull it straight out. There's lots and lots of advice on websites around how to do that. You can use other things. You can use a credit card with a little slit in it and slide that underneath. You can use tweezers, fine tip tweezers if you can, to get under it. But don't squeeze the body of the tick. Don't squeeze it. Don't try and get it with your fingers. Sometimes you can get them off with a fingernail from experience, but usually they are pretty well attached in there. What you want to try and do is get that tick off as quickly as you can. Don't burn it, don't smother it, don't try and put creams on it, don't do any of those things, because that makes it much more likely to regurgitate. What you don't want is that tick to be squeezed to put its contents of itself back into you, because that's more likely to spread the Borrelia bacteria, which results in Lyme. Now, if you can get that tick off relatively promptly, within a day or so of it attaching, the risk of transmission of Lyme is very low, even if the tick does have Lyme. The longer it's on, the higher the risk. So early removal of the tick is stage 1 of Lyme prevention. Obviously, not getting bitten at all is even better. Prevention is better than a cure. But if you do get a tick, make sure you remove it straight away. If it does leave in a small black speck or some mouth parts, don't dig them out. You don't need to. They will come out a little bit like a splinter over time. Your body will reject that and it'll come out. So just keep an eye on the site so it doesn't get infected or obviously infected, but just leaving the mouth parts in is actually okay. There's a bit of a myth that you must dig everything out. You don't. So dispose of the tick once you've removed it and then keep an eye on the site. So how do you know if you've got Lyme? Lyme disease usually manifests itself with a rash. And that rash can be at the site of the tick bite where the tick was actually attached, or it can be elsewhere on the body. And it's usually a sort of spreading red rash, not just like pimples, but actually a spreading red rash. And one of those rash, it's a very, very typical Lyme rash, is called erythema migrans. Basically posh words for redness that migrates, redness that is spreading. It can look a little bit like a bullseye. The ring of redness can spread out and leave a center and a sort of clear ring around it. So that typical bullseye rash is almost diagnostic of Lyme disease in the days or weeks following a tick bite. So do keep an eye out for that. That rash can be elsewhere on your body, so keep an eye out for other rashes. And the other thing to look out for is just a flu-like illness. What do I mean by that? Malaise, maybe some aching, maybe having headache, maybe some sweating, maybe just feeling lethargic. All of those things potentially are a sign of Lyme disease if they are days or weeks following on from a tick bite. So if you do get a tick bite, do I need to go and see the doctor straight away? No, you don't. Do you need to go see a pharmacist? Not really. Remove the tick, keep an eye on the site, keep an eye on your general health, and if you're okay, the likelihood is that you've escaped Lyme disease. It's not something that you would treat for every time. If I got treated every time I got a tick bite, as you can see, I'm out in my camper van, I spend a lot of time out in the woods and hiking. I'd be forever at the doctor's and taking doxycycline. So only if you get symptoms is it worth going to see a healthcare professional. Now, that rash and that early diagnosis is really, really important, because the earlier you treat Lyme, the easier it is to treat. This is one of the key factors. So early removal of the tick, if you do get symptoms, early treatment of those symptoms. And it's a relatively easy to treat disease in the early stages. We treat it with a drug called doxycycline, typically. It's a green capsule. That's the most common antibiotic used in Lyme. Usually it's one, sometimes two, but usually one tablet twice a day for 21 to 28 days is the usual guidance. And that will usually get rid of the Lyme disease. It'll kill the Borrelia bacteria, and you'll be fine afterwards. Very occasionally people can get chronic illness from Lyme, although that's very uncommon, and usually it's very treatable. If Lyme is left, that's when it becomes challenging. Lyme can create arthritis, so it can create joint pain, it can create joint swelling, it can get into your heart, it can create problems with your heart muscle and arrhythmias, so the rhythm of your heart can go funny. It can actually get into your brain and into your nerves as well. Those little spirochetes are really good at getting into tissue and causing damage, and that's not something you want to happen. So early treatment is key. If you do think you've got later Lyme, it's still worth going to see a healthcare professional, particularly if you can remember a rash or a flu-like illness or a tick bite and you think, actually, I wonder if I have got Lyme. There are some people walking about with Lyme disease, I'm sure, who don't know they have got it. Still treatable. Maybe might require some stronger antibiotics for longer. Maybe require some IV antibiotics intravenous, so via a drip. But most people will get away with oral treatment with some doxycycline for their Lyme. And then it's fully resolved. So that is essentially Lyme disease 101. Lots and lots of myths online, as I say, about burning ticks, putting petroleum jelly on them. Really not worth even thinking about. Spot the ticks early before they get on you, brush them off, wear repellent, keep out the way of ticks is your number one thing. Secondly, if you do get a tick, remove it as promptly as possible. It's not a scary thing to do. Tweezers, tick remover, pull straight out. If it does leave the mouth parts in, don't worry about them. Just keep an eye on the site. And then if you have had a tick attached to you, particularly if it's been on for a little while, look out for a spreading rash, the bullseye rash, a rash elsewhere on your body, or some flu-like symptoms, because that might be a sign of Lyme disease. If you do get any of those, go see a healthcare professional, go see your doctor. They will probably treat you with doxycycline and send off a blood test to confirm or basically do away with the diagnosis of Lyme, although those blood tests are not that reliable. So usually what you do is you treat clinically, you treat on the symptoms, you treat on the fact that someone says, I've had a tick bite, I've been camping, I've been somewhere where Lyme is pretty common, and now I've got a flu-like illness and I've got a rash. So keep an eye out for those things. I hope that's helpful. I hope you're all having a fantastic time out and about. Don't let it put you off hiking, don't let it put you off camping. Occasionally I do get them in the camper van, but you just brush them out of the way, wear some repellent and stay safe. I hope that's been useful. This, as always, is Healthcare Honestly. I'm Dr. Bruce Charlesworth. Please do like, subscribe and follow, and I look forward to speaking to you shortly. Thanks very much.